You know, acne has a very, very big emotional impact on patients. It's hard enough being a teenager without acne, and then if you have a lot of acne, there are really elegant studies that have shown that it lowers people's self-esteem, there's more absences from school and work, and then we haven't even talked about the scarring piece. So, you know, moderate to severe acne leads to scarring. So even though acne is only during adolescence, you know, if you have scar, that'll last your whole lifetime. So we really want to prevent scarring as well as dealing with the emotional well-being of our patients. I think if you look at the incidence of melanoma, it's increased dramatically in the last 100 years. There's a lot of reasons for this. I think that the rise of indoor tanning is a very important issue. And perhaps detection is better too. That could be a reason as well. We know that tanning salons are associated with melanoma. The evidence is incontrovertible at this point. And in the state of California, at least, we participated in legislation that has banned indoor tanning use for minors. So if you're under 18, you're not allowed to go to a tanning salon in California and in 9 other states, which I think is really important. Because tanning salons are associated with photoaging, skin cancer, and melanoma. If blistering sunburns are too. So if you have more than 5 blistering sunburns in adolescence, that is associated with an 80% increase in your melanoma risk. Non-melanoma skin cancer like basal cell skin cancer and squamous cell skin cancer are almost exclusively associated with the sun. So 99% of the time associated with the sun. Melanoma is a little trickier. Sun is definitely an important factor, but genetics are an important factor too. Certainly getting blistering sunburns is worse than being in the sun for 20 minutes a day. But you know, if you got skin cancer after your first sunbathing episode, or if you got lung cancer after your first pack of cigarettes, nobody would go in the sun, no one would smoke. So is it okay to spend a little bit of time? Is it okay to have 1 cigarette a day? You know, you're managing risk, so everybody manages risk differently. We know that the sun causes mutations in your DNA through ultraviolet radiation, and we know that those mutations eventually accumulate and lead to skin cancer. Well, psoriasis is a real success story. So in particular, pediatric psoriasis, we did not have good systemic treatment 5 or 10 years ago. We don't want to put those patients on prednisone. We don't want to put them on drugs like methotrexate. But now we have a whole toolbox of biologic therapies that are very safe and extremely effective. So it's really been a sea change. We have no cure for psoriasis. A lot of skin diseases there's no cure for, but we have excellent medications to control them now.